Women are commonly concerned about cancers when they think about replacing their hormones. Most of that information comes from a study that is now over 20 years old, the Women's Health Initiative, or the WHI. And in that study, women were on a specific type of hormone therapy, Premarin and medroxyprogesterone acetate, and they developed a higher rate of breast cancer and heart disease while they were on that therapy. In the last 20 years, we've learned that that study had numerous flaws. It had much older and less healthy patients enrolled, so it was skewed. Since that time, we've had numerous studies that show that a woman can safely go on hormone therapy, especially if she initiates it within the first 10 years of menopause. After 10 years, it becomes more problematic to start a woman, but if she begins hormones early to treat her symptomatic menopause, she lowers her risk of heart disease, she lowers her risk of type 2 diabetes, and she lowers her risk of osteoporosis, which actually kills more women in this country every year than breast cancer. A woman may ever so slightly increase her risk of breast cancer over her lifetime if she uses hormone therapy, but the benefits likely outweigh the risk.